And you still don't feel that great?
I feel great.
Oh.
Because what I do is make sure I keep myself healthy. I try to live by example. I stretch every day, exercise 5 days a week, and I eat as well as I can. Okay, sometimes I'll try a new diet plan or a new eating plan. I don't call it diet, more of an eating plan, where I'll do certain things and kind of work that way. Even with exercise too, sometimes I'll mix some exercises to do more cardio, more yoga, more Pilates, even more biking, more swimming, based on the season, obviously. Okay. So my biggest problem with me, I like to lift heavy weights, so I lose my flexibility. Okay. So because of that, I do yoga once a week every Tuesday morning at 9, and it kicks my tail because it's hard for me because I need that balance in my life. Okay. Physical health, if you want to call it physical health, are 3 things. It's going to be flexibility, endurance, and strength. You need all 3 in balance. I have people come in that do heavy construction work. What do you think their strength is? What do you think their imbalance is when they do heavy construction?
Pretty good.
Yeah.
Well, what's their overall? Do they have more flexibility or more strength?
More strength.
More strength, right?
Yeah.
So they come in causing injuries, maybe neuropathy, muscle pain, spine pain, because they don't stretch.
Oh.
Okay.
And
so
what about cardio? Maybe they need cardio.
exactly, cardio is part of it too, the endurance part.
Yeah.
Why is cardio important?
Keeps your heart going.
Exactly. Why does it keep your heart going?
Exercise. It pumps faster.
What is an exercise? How does it exercise your heart? What does your heart exercise do?
Muscle.
So if you have your heart, right?
Mm-hmm.
Okay. And realize initially, if you don't know me, I have very low artistic ability. I'm not an artist at all. Penmanship is very minimal too, so if you have any questions, let me know. If I have a heart and I have heart valves coming off of here, right? Here, 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 and here, here. Okay. All these valves pump blood, some coming in, some coming out, to the body and from the lungs. Okay? If that's occurring, what happens to these arteries if we don't move? Come on, grab a stool if you
Don't
want.
get enough oxygen.
I'm sorry.
Dr.
Yes, yes.
Some people wanted the fan, and
I'm not worried about the fan right now.
Why'd you close the door? Because it
Exactly.
was fine.
Well, I'm worried about more of the noise out there. I get distracted very easily. I have problems. Okay.
Yeah.
So
The
my biggest,
ADD, I
just don't
have
move.
it too.
If you don't move, then you won't get high. You'll be fine. I'm going to be moving up here. Okay, I'll do all the moving today. Okay, for right now. So what happens is when we have these arteries, the arteries, are they elastic or are they more like a piece of pipe?
They're supposed to be elastic.
Elastic, right?
Elastic.
What happens is when we need the cardio, we need them to keep elastic, to stay elastic. They have to keep moving, keep pumping blood through there, causing increase in pressure. So we go from, say, a minimal amount, where it's here, we're resting, breathing, we're resting and we're sleeping, to more we're doing cardio, maybe getting our heart rate up a little bit, to more of this amount here. Okay, more of a higher amount. I'll draw it over here, make it easier to see. Where when we're doing cardio, getting our heart rate up, that's because we want those things to stretch. If they don't stretch, what happens?
They get constricted. and
They
then
they
it's
stay.
harder to pump the.
Well, they stay at a normal level because there's normal pressure. But what happens to the artery, the walls of those arteries?
They get thick.
They get thick with plaque, right? With calcium. Okay, if they get thick with calcium, do they lose their elasticity?
Yeah.
Yes, I'm leading the witness today. I'm not asking questions, more telling you what's going on. Okay, that happens if they get calcified and plaqued, if you want to call it that. Can they tear or break very easier?
Yes.
Okay, so what happens is over time, if you lose elasticity, you have more chance of a stroke or an aneurysm. That's why you see people now they're in their 30s and 40s having strokes and aneurysms versus just in their 50s and 60s and 70s. They're not staying active enough. And how does stress play in the part of that too?
Big part.
Big part. When you're stressed, what happens to your heart? I mean chronic stress.
Well, it probably
Does it pump
overworks.
more?
Mhm.
It pumps
Overworks.
more, right? I have people come into my office that are stressed and they have heart palpitations.
Mhm.
They don't have a heart problem, but the stress from the brain, it's called your sympathetic branch, goes to your heart, makes your heart stay active the whole time. So your resting breathing when you're sleeping is a high amount. Okay, any questions about that?
How do you reverse it?
De-stress your body. find out what stressors are in your life and either decrease those stressors, which is hard to do sometimes, or how do you tolerate more stress by being physically healthier? Does that make sense?
Yeah, but you talk about plaque and
Yes.
hardening and all that stuff. That's already happened.
If it hasn't happened, say for example, if it happened, you may be prone for that. They may want to do heart surgery or something like that, a critical bypass, whatever it might be. But how do you prevent that from happening?
Okay.
That's my biggest thing. I'm not a cardiologist, I'm just a chiropractor, a dad with at least 4 kids as far as I know. Okay. My biggest thing is how do you make your body healthier by doing some walking. Talked about before is going outside and counting 20 trees when you go for a walk. Okay, keeping yourself active. My patient I had a couple years ago, Georgia City of Commerce, lived in Rancho, came in same situation, had heart palpitations, overly stressed, on anxiety, depression medication. Not heart medication because she hadn't had a heart problem, heart was fine. But the stress from her work, from driving from Rancho to City of Commerce every day, working 8 hours at a desk, driving back every day, hour and a half traffic every day, she was worn out. So she came to my office going, I may have spine problems, but either I quit my job or I have to figure out what else I can do. So what I did is get into a routine of she had some spinal stuff going on, but more importantly, getting her to walk when she came home from work 20 minutes a day. On her hour lunch break, walk 10 minutes a day. Increase it 5 minutes every week, and even increase it more as she felt more comfortable, where she was walking her 45-minute lunch break, coming home walking, and doing some light weights to get her body to feel better. When you work out your body and you feel good with that, what happens is you want to work out more. She didn't realize that was her problem. Her medical doctors wanted to do more drugs with her, more medications, and have her quit her job. It was more of how do we increase your health to tolerate the stress of your everyday life. Now she's fine. But she knows she has to do her walks or the stress will get to her body. So how do we adjust what we're doing to add some exercise to our life, get ourselves healthier, maybe even be diet, nutrition, or watching or avoid watching bad daytime TV to keep ourselves healthier? Okay? Any questions about that? The crowd goes silent. Yes?
Yeah, I never had a doctor tell me that, and they, because they work from the, how would somebody say, from the illness point of view, and
Yes.
they make money by keeping you medicated and then not well.
Yes. True. That's what's the biggest thing? What's the biggest treatment of every medical doctor?
Pills.
Pills.
Drugs.
Pills.
Okay. That, and some people need that. I had a patient call me earlier. She's in severe pain. I said, she's at her primary doctor right now. Get something just to calm it down. Because I need you at a level 4 or 5 to treat you to come in the office. If you're level 8 or 9, I don't want to see you because you can't even drive to the office. She had a family friend drive her to their primary doctor. So I need to calm down her level. But once it's less intense, how do you avoid the chronic medication where that gets you spiral for more and more medications? Okay. The neuropathy part of how things work, it happens 2 ways. We talked about this before, but let's go over this again. I'm going to use 2 pens. One is going to be your parasympathetic system. Okay. Neuropathy comes from the nerves. Okay, master the obvious, obviously. And the nerves just out here in the actual, say, arms and legs? Or do the nerves affect the whole body?
The whole body.
Whole body, right? What's the central nervous system? What's the main part of the system?
Spinal cord.
Spinal cord, and also brain too. That's all. Your central system is going to be here and here, combination of both. Okay. If that's connected from here to here, that branches out to your arms and to your legs, affecting the muscles too, along with the organs in your body. Okay, I'm going to give you something that explains that. Pretty sure I brought that. Yep, here it is. Helps break it down for you how the nerves work. And I'll walk through how it can be effective to help you or kill you.
Can I ask a question about
Yes.
that? I know my legs and back hurt so, feet, you know, it hurts so bad that someday, you know, I walk, I try to walk more, but then later I hurt worse than I did before I walked.
What have you done so far to find out why that's happening?
Why the pain?
Yes.
Oh.
Why is it later in the day?
It could be when I wake up in the morning too, but it's not as bad. Nighttime is the worst. It's
Is it both legs or one leg?
both.
Okay.
And the back. Seems like it's affected the back more now. And the back's affecting the legs, which is.
And what I'll walk through you once I walk through some of this, it may understand what's going on.
Oh, okay.
Is affect how you've adjusted your body to deal with the pain, and how that adjustment may have catch-22'd to make sure it actually maintains the pain.
Oh,
Maybe the
that's-
weakness too.
Good job. The weakness, very bad, yeah.
The weakness, and the weakness can cause more pain. So you want to do less or adjust your posture even more
That's even worse.
to make your even body feel better.
Yeah, my posture is going. Peep.
So our job is, and this is what I deal with every day.
Yeah.
If my body's coming forward, it's causing the spinal cord in the back, which is inside the spine itself, inside the bones, to stretch like a bungee cord. When it does it, it causes tension in the whole central nervous system, which affects from your tailbone up to your brain. So your whole body is affected. If I do this, if I'm natural like this, my normal posture, I'll be the model posture guy right now. And my spinal cord is relaxed. If I come here, it stretches from the low back to the shoulders. The neck not as much because your neck will actually do this. You're not going to want to fall forward, right? So the body does this, tightens itself up to make your shoulders come up. Neck stays kind of relaxed. So you maintain your center of gravity. If you're doing that, the whole spinal cord is under tension, under stress, so it can cause neuropathy anywhere.
Oh, isn't that interesting?
But your lower back is where all your load is. At your belt line, 80% of your body weight sits right here. That's more common to lock out, then start working out the disc, then affect the nerves that go down the leg. That's the sequence of events that I usually see
Yeah.
over a period of years, meaning 5, 7, 10 years.
Yeah.
If you have an injury, accelerate that process by about 2 times faster. Okay.
Okay.
The good news is it's fixable. That's the good news.
Good to hear, isn't it?
I don't want to depress everyone. Everyone's going downhill at this point. Okay? So we talk about 2 things here. The central nervous system. So we have the whole nervous system here. Goes from the brain, spinal cord, and then branches out to all parts of the body. Okay? And then here we have parasympathetic. Anyone remember from my last lecture what parasympathetic is? It's muscle, come on.
We weren't here.
You take notes and everything.
Did you take?
Who takes notes?
I thought you were brain. This is your rest and relaxation. This is how your body, that nerve system part of it, is how your body, when it rests, it actually shuts down. It allows your organs to repair, allows muscles to repair. That's when you say you pull the muscle, get some rest. The goal is to make sure that everything has time to repair itself and relax. Keeps your body de-stressed at a relaxed state. Okay? The opposite of this, the antithesis, is going to be your sympathetic system. Okay? Sympathetic, Jesus. Gosh. I need to take that tick. Something like that, I don't know. Okay.
Sympathetic.
Sympathetic system. I don't know. Horrible math. Horrible English person. But that should be your stress system. That's when your body is in fight or flight, being chased by a tiger. Okay? You need the balance. Why? To stay alive. We still have the same genetics as we had when we were Homo sapiens, cave people, 3,000, 4,000 years ago. Our genetics have not changed. Our environment has, our stressors have, so we have to adjust to our stressors in our lives to make sure we maintain this overall balance. Any questions so far? So just to recap, increased stress. This will go back to neuropathy in a second too. This is what we want to understand is how the nerves work to maintain our balance in our body. And if it's balanced, to be able to handle the stressors of our life or tolerate more stressors as it gets healthier. Okay? This is decreased stress. I'll draw this in green to be symbiotic. So, if my body is more stressed, how would it affect my heart?
Badly.
Badly, exactly. For example, will it cause increased heart rate or decreased heart rate?
Increase.
Will it increase your blood pressure or decrease your blood pressure?
Increase.
Exactly. Will it make, if it's too stressed, will it cause sometimes a feeling of a heart attack?
Yes.
Yes. Okay, again, this is non-traumatic, over time, chronic type of stress. Like driving to LA every day for work. I don't know how people do that.
I shoot.
They do it every day. So there's probably 100,000 people every day that do that. That they're eating, they're on the phone, they're shaving, they're doing their makeup. Even guys are doing the makeup these days. I don't know what they're doing. How that works. Okay? So realize when your body's under stress, neuropathy can hit anywhere in the body. Okay? Let's go to your sheet. I hand it out. At the very top, on the left-hand side, it says vertebrae, areas or location, and effects on the body. Okay, any questions? You okay with that? So the location is going to be your vertebrae, location inside the body, the areas, and also the effects on the body or your neuropathy or symptoms of what you're feeling. Okay? Got that? Good? Good? We're on the same page here?
I can't see because I didn't bring my glasses, but I'll have to look at
I'll
it when
let
I
you
get
borrow
home.
mine if I had, but I don't wear glasses yet.
Oh,
Sorry.
no, that wouldn't work. I don't think.
Like my wife has like 4 of them in the car, so she has like reading glasses for everything.
Oh, okay. Well, I'll read it when I get home.
The very top portion says here the areas where it says blood supply to the head. Everyone see that? Okay. When you go through that, it says blood supply to the head, pituitary gland, location of the scalp, also the bones of the face, the brain, the inner and middle ear. It says sympathetic nervous system. Whoa! I just heard that somewhere. That's right up here. Okay. So the example is, if the C1 vertebrae is being pinched or locked where it can't move properly, it can cause these areas in here being affected to cause the effects of the sympathetic nervous system, which will be headaches, nervousness, insomnia, head colds, high blood pressure, migraine headaches, nervous breakdowns, amnesia, chronic tiredness, and dizziness. This is a medical. This is from Gray's Anatomy. It's not a chiropractic thing. This is not just my religion. Okay, but this is basically what they say how things are connected in the body. So some chiropractors, all they do is adjust to see what their vertebrae. Not because they're lazy, because you realize how important that is in the body. We adjust the whole spine. So that's the plan. That's what we do.
Manually? I'm sorry.
Manually, or with an activator too.
Oh, because
Oh, is that, I call it the clicker. Do
It's
you
the
use
clicker,
that?
yeah. Not the clicker in your pocket, but the
I
clicker.
know.
The clicker. It's an activator, but yeah, it's a clicker thing. People,
Okay.
if someone has osteoporosis or carotid artery issues, that's the safest way to adjust the spine.
Okay.
If those are things that
That
people
was
need.
one of my questions for you.
That's what people do. And that's what we have different options for people. We're a clinic, not just the one philosophy, one technique. And I mean, you have to do everything for everybody. You know, some people are going to want some technique that I've never heard from, like, great, go somewhere else. But you got to figure out what works for you. When a spine locks, that's what happens. The effects of that's going to happen. That's your neuropathy. Okay, any questions about that? So is migraine headaches a neuropathy? A form of neuropathy? Yes. Okay. Is nervousness a form of neuropathy?
Yes.
Yes. Okay. So realize things that be treated with mostly medication is what chiropractors treat also. Yes.
So, Dr. Tony,
Yes.
So the spinal cord just developed or evolved over time, right?
It develops after 7 days of fertilization as a primitive node, a primitive streak. Okay. So when you first develop, your body does this. 'Cause I learned this a while back. I think I saw it on TV probably. You have your mesoderm. Okay, that's the first interaction of the sperm and egg cells together, causing things to start interacting, developing, and separating, dividing different cells. After 7 days, you have the primitive node and the primitive streak. From embryology class. What do you think these are down the line?
Brain and spinal cord.
What? They match up. Exactly. That's how things form. And from there, things branch out from the brain down through the spinal cord or primitive node, primitive streak, out to the opposite side, spinal thymic tract, upper part of the body, lower side, lower part of the body. and hence more organs, bones form, and then you start being birthed, and you're out. All right. Any questions beyond going back to that? All right, but that's how the body forms to develop. So we talked about C1 nerve root. Let's jump down to the lower portion of the back, where it's going to be hard to see for some people. You see this thick line? Okay. There's another one right below that. Let's go down here where it says lower legs, ankles, and feet. Got that? Right there. That one. Okay. Yes. Hey, Miranda, how are you? I'm trying to hide from you. You keep finding me. I'm going to grab one more chair for you.
I'm Ren.
Grab a seat, grab a seat.
Yeah, take Tony's. He
Yeah, exactly. He'll be right back. He'll figure. He works here, kind of.
can sit on the floor.
Let him come back. I don't want him to miss this because I'll answer more questions. If I answer it again, I'll forget. Come on in, sir. Be right behind the door. All right. So we talked about here. Let me get one for you too, Miranda. Get caught up in a minute. We're talking about here is the vertebrae of the spine. And we're talking about right now is the area of the lower legs, ankles, and feet down here, and how it's affected with neuropathy in that area. Okay? So when you go to that spot, it'll say poor circulation of the legs, swollen ankles, and cramps with ankles and arches, cold feet, weakness in the legs, and leg cramps. Okay? People that come in my office and go, I don't have a lot of leg pain, but my leg is always tight. Always the same leg, always back here when I wake up in the morning. I go, let's see. Could it be neuropathy? Maybe, maybe not. So what I do, look at the spine and on an x-ray and see if it can be pinched in that area. And that'll be a sign of neuropathy. It doesn't have to be severe pain, leg weakness, cramping, it burns all the time. There's different levels of neuropathy, you understand that, to where it can cause just slight weakness or an imbalance or some tightness where it doesn't go away. And it's one side every time. Okay, that's important to me because that can be a disc problem causing that to happen. Okay, do everyone know how a disc works in the spine? You guys all took biology, vertebral and anatomy and physiology in college,
all
right?
that, sure.
Okay,
Yeah,
good.
definitely.
Want to make sure. Here's a vertebrae. Okay, here's a spine. Here's one vertebrae. Here's one below that. Okay, in a normal spine, that has a disc. That has, it's like a ligamentous tissue, but it acts almost like a balloon where it can swell, filled with spinal fluid, and also de-swell at the same time. That allows you to compress your body, decompress your body. Go to pick something up, stand up again. All that causes motion in there. Okay? There's joints around there too. That's where most of the load occurs. In a normal spine, that area here, and I'll represent it with a normal. Notice this is going to be the front view. This will be the side view. Here. That area from the side view allows the back of the spine where the canal is here. That open space here is where the nerve can be pinched or not pinched. So in that area it has a lot of room. I'll draw the other one in a second. Okay? So that opening stays really big, so even if you compress the actual load on the spine, it won't cause any pressure on the nerve, causing neuropathy. Okay? Any questions about that? That's normal. Front view, side view. Here's abnormal, where now the disc has worn itself down from a lack of motion in the spine. And side view too. Let's draw here, 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 here. And now you've lost the spacing where that's very small. And I'm a horrible drawer, so I apologize.
What
But
happened?
it allows you to see that if I've lost the disc space between the vertebrae, now you've pinched the nerve. And over time, it can cause neuropathy where it goes from slow little bit of pain here and there. You wake up one day, lean over the sink to brush your teeth, and your back goes out. You're in severe pain. That's usually what I see, especially with guys. They're macho men. They can handle a lot, but all of a sudden put them on the ground and go, now call the doctor.
What does that term mean? The back goes out.
It can be different things. It can be where your disc actually be affected like this, where it locks in play, and now you've herniated or bulged the disc.
Oh.
So you pinched a nerve, causing, for example, severe leg pain or back pain by a bulging disc,
And how do you reduce the bulge?
by causing more spine motion.
Oh.
Once you cause more spine motion, realize this is a good example I've used in the past. My elbow is one joint, okay, like this joint here, okay? Normally, if I move my joint all the time, it's nice and free, it's a normal healthy joint. It stays lubricated and allows circulation of the muscle above and below. Keeps these muscles strong and relaxed, okay? If my elbow joint's like this, where it's rigid, arthritic, it can't move properly, what happens to muscles above and below?
You're weak.
They get weak and painful. Same thing here, it makes the nerve, everything in that area where the nerve's being affected, weak and painful. So our job is to make that circulation occur in that disc more motion, more motion, more motion, to make it look like this. Regenerate that disc without surgery or drugs. We move the spine, we move the spine, we move the spine to make it get back here so it stays there. And we add stretches and exercises also so it stays there. It doesn't go back. Yes.
You need more exercise.
I
Give me a
wonder.
second, Amanda. Yes.
Oh, I'm sorry.
You're good, good.
What happens when the bone is rubbing against the bone? You can't repair it in between.
If it's that bad, then that might be that bad. Once it rubs on the bone, what happens, you'll wear out the periosteum and the bones start growing together and they'll fuse together naturally.
And there's not much you can do about that.
That's
So
that's what mine
That's it.
is.
Start doing this. No, good. But the biggest thing is, how do the areas of if the whole spine is fused together, that's very, very rare. But how about if one area is fused like this, but the areas above and below are still workable? See, unlike an elbow, that's one joint. Your spine, your lower back has 7 joints. The neck has about 7, or the neck has about 6 joints, and the middle back has about 12 joints. So you have enough joints to work with. If one's stuck, keep the other ones moving.
Oh, okay, I understand.
That's the biggest thing. Unlike one joint, it's screwed. 100% is right there. All your motion's right there. Your lower back, you have 7 joints. So 1/7, I don't know what number that is, will be the percentage that's being worn down if you have one fused together. Problem is, if you leave it there, the areas above will have to work harder, so now you domino effect.
How do you know what exercises to do when you have back like that? And they're not hurting the rest of it or putting it out, or
So you want to make sure you use an x-ray to now analyze it first. X-ray will dictate what you can and can't do, and slowly progress more and more and more. See, with us, an x-ray tells us exactly where the problems are, left or right, front and back, and also how much disc is still left.
Oh.
With that, knowing that, how much disc can we recover? If nothing at all there, that's fine. Let's work the ones above and below, and work them slowly. Okay, because the problem is, when you start exercising too early, you have scar tissue in the joint. And scar tissue does not act like a muscle or ligament. It actually is like glue. It doesn't want to move, has no elasticity. When you have that, you have to break it up slowly, to make sure it doesn't cause any injuries or any problems with severe pain. We'll do that with ultrasound therapy and slow stretching. Slow stretching. After you've broken off enough where it feels good, then we add the more aggressive stretching and strengthening too. So if my body's stuck like this, say for a back injury, even back surgery, we want to do slowly, stretch things out this way, this way, this way, then add exercises. Get the body to a better posture, better position. Even if this is locked up here, you've had surgery, how about the hips? How about the upper back? Get everything else moving properly, take the pressure off the spine. Once the spine goes back to a normal curve, or as normal as possible, that's the least amount of load on your body. Your body can handle this over time better than this. This makes the body long-term wear itself even faster. So our job is to get the body to look a little more like this over time by causing more joint motion. Realize all the bones in your body, for the most part, have normal bones. They're just not lined up properly. When they unline or become very straight, things will lock in play. Our job is to get the alignment back in play so we can reduce the neuropathies that you see in the sheet and get the spine to move properly so it stays there. The spine's not meant to wear down. It wears down because it locks in play. You have arthritis in your spine not because you're old or young, it's because the spine, some reason down the line, locked up. How long you've had the condition will dictate how much arthritis you're going to have in your body. I had kids that have 23 years old, 24 years old arthritis because they're in the Army at 18 years old. They're 140 pounds, carrying an 80-pound backpack.
Oh my
It
goodness.
just wore down their body too quickly. So 2 years or 5 years later, now they have arthritis because they had it long enough. Yeah.
Sad.
Right. Yes.
So what do you think about the inversion machines,
Those are okay, short term.
short term?
Those are short, 2-3 minutes. It allows your spine to decompress, open up, because we're being loaded by our body mass and gravity every day.
How long should you use it?
Everybody's different. Maybe start with 30 seconds, maybe a minute. Again, depends how your spine looks, how much arthritis you have in there, and how much scar tissue you have in there. Because you have scar tissue, if you try to stretch it too quickly, it'll cause rip and tear. It can also tear the disc.
So it actually somewhat solves this problem?
It can decompress the spine if there's normal motion already. It won't cause a curve in the spine because realize you're going to pull things apart. You're causing a straightening, not a curve. But it'll decompress, allow some pressure off that spine. Realize ligaments in the spine, in the very front and back of the ligaments, that control the spinal motion too. If there's scar tissue in there, like an artery, it'll sometimes tear that ligament. So you have to get the x-rays done, maybe an MRI first, before you start something like that. But you can buy them at Big Five, Walmart, Target, online, so people think it's okay for them to try. I see probably about 3 or 4 injuries a year from the inversion table.
Oh,
Because they don't look at what their body's doing first, they just go right at it. Especially if they have a problem condition already trying to fix, that can make it worse. But I have patients that use it all the time. Once they clear, do that. Yes, yes, Brandon.
Yeah, I have fusion from L4, L5,
Yes.
and S1.
Mhm.
Hanging me, is it gonna stretch it out?
Well, yours, because you have it for a long time, you probably have a lot of scar tissue in there, I'd hold off on it. You want to make sure you have normal motion in the body first, because yours, that's where all the load occurs, the L5, S1, and L4. It can cause that to tear.
But I can bend all the way down.
But when you
Am I doing-
decompress like that, when you hang upside down, your body's used to that position. Your body didn't grow that way. It grew this way with the weight on top of your head.
Because now I'm having pain on this S5 nerve.
Yeah, S5 or S1, L5, S1.
S1, oh,
It
okay.
goes inside of the foot right there, and sometimes the big toe.
Yeah, but then why isn't the part in the middle is not hurting, it's only down?
Because it's separate, because it's a muscular branch versus a neuropathy branch down here. It jumps. For example, if you have an ulnar nerve problem in the neck, it'll jump from here down to here to the fingers. There's different sensations that can happen. You're not gonna every nerve you're not gonna feel. The nerves at the heart, you don't feel the nerves that go from the head to the heart, but you feel the end point, which is the heart, or the end point, which is the toe, or the knee, or the lower back. So realize neuropathy and the physiology behind that, how the nerves travel, it's not a straight line all the time. People sometimes come into my office, just knee pain. The x-ray MRI is negative, it's fine, take the low back x-ray, the low back x-ray is bad. We fix the lower back, knee pain goes away. Magic. No, it's not magic, it's physiology. Science, sorry. It's not that science, not that exciting.
wow.
We understand the science behind it. That's why using the sheet, looking at the sheet long term, allows you to diagnose your own problems, how the body works. This is your cheat sheet. Okay? How the body, this is physiology, not chiropractic. This is how the body works.
So how do I get rid of the pain?
You have the fusion. Once you
Wow.
fuse the body in that area, focus on stretching, and when you feel comfortable, keeping your body back and strengthening too. Okay, so good question. That's my next part. Thank you for introducing it. How to reduce things, cause more spine motion, get the body back to normal position here over time by light stretching first and then strengthening over time. Once you get there, you have to stay there. Okay? If I have an injury, I may have to use something like this for a short period of time. What happens long term, I get dependent on this, so I use this as a crutch versus my own body weight. And this is just a common problem people have. But if we don't have a major problem going on, how do we get our body stronger? Sometimes going through some pain some discomfort, to understand long term I have to go through this to make my body healthy so I don't end up in a wheelchair. All right? The depressing side. We have to do the work. When our body's healthy enough to do that, so get checked out first. Yes?
Well, I was just thinking while you're talking about nerves and everything, it's
Yes.
kind of odd to have the back hurt and the upper part of your legs hurt.
The thigh?
Yeah.
Why?
Well, and not have the lower part of your leg hurt as badly, and then the ankles and feet hurt really bad. Why is it because we have that in between, or did you just explain that?
No, I did not explain it.
Oh, and I thought it odd that you could hurt in one place in the same like leg and not hurt in a different
That
place.
is
You
very odd.
think the whole leg would hurt.
You would think, right?
Well, sometimes, but not as often.
Well, it's like the example of just having knee pain from a back problem.
Yeah.
You can have just upper thigh pain and foot pain or lower leg pain too. Okay? So if you want to take the lower back of the spine, say that last part here, this last between the two big block lines, that's your lower back for the most part. Okay? I'm going to try to draw that out so you see that. Let me see if I can do this here. There we go. So you have your tailbone. Okay, you have your L5 vertebrae. Oh man. You have your L4, L3, L2, and L1. That's your lumbar spine, that's your lower back spine. 80% of your body weight sits right here between the L4, L5 disc and the L4, L5 and also L5, S1. So between L4, L5 and your tailbone.
That's not right.
From there it goes down your pelvis on both sides, dissipates the weight that way.
Yeah.
Bigger bones in pelvis, they can handle the weight. This area is not meant to handle weight because it has to have motion. Okay, that's the balancing point. What happens in sciatica, which is what you're talking about, this nerve here, 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 form one trunk. Let's get all these nerves down here, blah, blah, blah. They cross over, called a plexus, things like that. Then they branch off again down the leg, certain ways. Because when they join together, they form this hodgepodge of nerves and wiring. They branch off again so they can cause problems here, problems to your groin, problems down your leg, problems down the back of your leg, problems to your feet.
I'm lucky.
Anywhere. Anywhere. Same thing with the neck down the arm. Same thing that way too. So when they branch and form together, they branch off again, realize it's coming from any of these areas. So when someone says, I just have a big toe problem, it's my S1 nerve root, we'll see. Let's take the x-ray and see. See the MRI and see. That's more common to happen, but let's make sure. When a surgeon goes in someone's back, they don't go, the book says this, I'm just going to do this, and that's it. They have to go in there, and because everyone doesn't fit the book, figure out where things are connected, where things are, how things are different than the book. That's practice, practice, practice. In anatomy, everyone's body is about 30% different than everybody else. So realize my nerves may go this way, they may not go that way. You have to really look at the big picture. But what we know, if these vertebrae are locking up, affecting these discs between the bones, all these discs, then that's more likely to pinch the nerve, causing neuropathy. So our job is to fix the source of the spine of the problem, if that's what it is, fix the spine to make it line up properly, get those discs healthy again by causing more motion. If I could put a big banner on my front door, it would be cause more spine motion. That's what we do. So everything else in sequence cause neuropathy to reduce or get better or get 100%.
If you have scoliosis, can you straighten that out?
If someone is under 21, yes. Okay? If someone is over 21 and their posture is like this, a bad posture, if you reduce your back to where it has better posture, it'll reduce that scoliosis to a certain degree. It's called coupled motion. The more I bend to one side, the more I'm going to twist also. Okay, same thing. Get my posture better, it'll reduce that scoliosis to a certain point. So I work with teenagers. A lot of teenage girls have scoliosis. I get their posture better first, then we take the x-ray.
Oh, interesting.
A lot of females in high school, my daughter's 14 years old now, they want to hide their body. Especially if they're taller. And they sit in a chair all day too. And they write like this all day. They leave school like this. You know? So you do that from your 5 years old till you're 18 years old, you can be pretty screwed up. So our job is get their body back here first, get their back looser and stronger, and then take the X-ray, see how much scoliosis actually is. Okay, we treat scoliosis all the time. We treat it to fix it, correct it, not wait and see till surgery has to happen. Most people do. Yes?
Do your kids use book bags?
I hope so. Yeah, they do.
Doesn't it cause problems?
It does.
Yeah.
So because my kids are in a lot of sports, they stay active enough to de-stress their body, stay strong, to help balance that out.
But
It's
the
not a problem,
average
Sharon.
kid still has a problem.
Average kid, you have to watch their posture and see where they are. How they write, how they sit in a chair. Because you'll be doing that about 6-7 hours a day sometimes. Painful. Think about that. It's institutionalized. School. Crazy. So looking at the big picture is even if you're not in high school right now, which I don't think anyone is here, is how do you get your body back here by doing stretching, by strengthening, by walking, and with a normal position, normal posture. Okay, so if I stand, for me, again, we talked about a couple times already, how do I check my posture where I am with my patients? Put their heels against the wall. I can't use that because of here. Heels, hips, shoulder, and head. I want my body, all those parts touching.
Oh, it's painful.
Yeah. Sorry about that.
Painful.
Torture.
Sorry.
But we want it
do
here
it.
because that's normal standard posture.
Oh, no.
If someone doesn't have that, what's sore, what's painful, we take the x-ray, see what's going on. Over time, you let yours to stretch, so that becomes your better posture. It's going to feel weird, awkward, sometimes painful getting there, but if you want to get your body healthy so it doesn't wear itself down, again, lock up the spine, wear out the disc, cause neuropathy, that can be permanent, you have to change your posture. When someone walks, and this is not to cut you off a second, someone walks, I'm on Euclid, every time I come down Euclid for work, people walk like this all day long. On Euclid. Okay, what does that do? Reinforce this posture. That's their normal in their head. That's straight to them. That's their straight. I want someone that does this, that has back pain, walk like this. Once the pain goes away, it's going to feel awkward and like they're leaning backwards. Their brain's going to see, I'm going too far back, got to be careful. But once you do this for a while, and your body sees this is normal and becoming normal, and that stays that way. You have to retrain your brain where normal is for you. Feels weird and awkward, like going to high school or something like that. You know, but you have to realize how to get your body back to better normal. That keeps things loose, so your body stays healthy. Keeps neuropathy down. Yes.
Just one more question.
2 more questions. That's it.
When people start a regime like that,
Yes.
it's going to be very painful to start with.
So we actually start really at a lower level with some light stretching on the ground first, or on a table or on a bed.
Okay.
If that feels good, and then you progress towards more of a loaded standing posture.
But if we were to do it at home,
Yes.
you know, and like you said, stand against the wall, which is absolutely horrible,
Yes.
probably to most people.
It's tough.
If it hurts, should we keep doing it and not overdo ourselves, but should we keep doing it even if it hurts?
Not hurt, but it should be tight. So you want to have it where tight. When I'm talking about the hurt or the pain, is when you progress from the soreness, we're doing some of the walking, some of the exercising where that might be sore. Where you strengthen your body. Well, if you're just starting out, just go to tightness, not pain. Let me show you something real quick what to start with. Okay? Give you one stretch for your lower back. Who doesn't have lower back pain? Okay? One stretch to start with. My wife's map says taking the time to soak up the sunshine
Oh,
of my life. Wow, how cute. Okay. So here, if my body is like this, right? My back feels when I lean against the wall. My back, I can't touch my shoulders or head. Okay? So what I want to do is reverse that by doing this. But if I do this right now, I'm like, my back hurts way too much today. You're not going to want to do that. So you want to do is lie on the ground. I know.
I can do that.
Or the bed, or a couch, or something where you're comfortable, wherever you lie down normally, and then slowly lie on your stomach, just like this. Okay, head here, wherever you want to go. If that feels comfortable, and then slowly go to your elbows.
Yeah.
that feels comfortable, then slowly bring your elbows behind you more like this. If that feels comfortable, then slowly bring up one leg at a time, where that feels comfortable. Okay? That's how you want to progress.
Okay.
And only bring your leg up to where it feels comfortable and tight but not painful. Oh, everyone's in.
What about laying on your back? If you lay on your back, you're in the same position that you were in when you had your back against the wall. But now you're against the floor. Isn't that the same thing?
It is, but you can't get extension that way. You can't extend your back this way.
Well, you're not extending your back when you're standing either.
No, but you want to be able to, but you want to, when you're standing and it's not comfortable, your back is in flexion a little bit. So here, get a question. So here, if my back's against the wall, and this is my normal posture where this feels comfortable, I can't go back this way, my body's stuck in flexion. I want to get it back here. If I lie on the ground, how am I going to do that? Where if I'm like this comfortably, how can I go back more?
Well, you don't when you're standing against the wall.
Oh, you don't
So you may want to start here then, just to feel comfortable this way.
But you don't straighten your legs?
You can if you want, but you're not going to get a lot of motion out of there. Most people can lie down pretty simply and not have any pain.
I would think taking a load off of your spine in that position would be more beneficial than standing.
Exactly. So we want to start doing things on the ground first or flat versus standing. So you can start this if you want, but you're not going to get a lot of motion in your lower back. Because your back is...
That way I can go to sleep.
Yeah.
No, exactly. But if we can go from here to on our stomach and get our body to extend slowly, like we're on our elbows, then our body can go from there to here to here to here. Then we can stretch out slowly. Then we can start doing exercises this way to make our back stronger this way too. So going from the ground to an extended posture, relaxed posture this way on the ground, say this is the floor here, this way, to where now I'm moving my body up and down that way too, in that same position, that's going to seem a little bit difficult. But once you feel better this way, then lock in this way with exercising. Move your body back more. Because your body needs to go backwards. Once you fix the curve of the spine like it does go backwards now, like here, you want to get there so your muscles adapt that better position and stay that way. So your job as chiropractor is to change the spine. Your job is to make sure your structure, your soft tissues, your muscle ligaments, adjust that very quickly so it holds that position.
Oh, excuse me.
Yes.
But, do you mind opening the door? Because it's getting so warm in
It's
here.
only like 95 degrees in here.
Yes.
I know. And I'm going to sleep, like, and I hate to miss anything. You know,
Thank
so-
Is that okay?
Sure.
Is there any questions about that? So we want to work, if we're going to work exercise, we're going to work stretching. Always, for me, always lying down first takes the weight off of your body. Start on your back if you want. If that feels comfortable, go on your stomach and just slowly extend your body backwards. Then go one leg at a time. Okay? That feels comfortable. And then start doing some exercises like these against the wall where the wall's straight. Because now you feel comfortable this way. And then work the muscles this way. Once you feel comfortable lying on your stomach with your arms up, then you should be able to slowly get your body back so when you walk, you lean back more. When you walk, you're not on your toes or your midfoot, you're more on your heel, leaning back more. Where you feel comfortable, lean back a little bit. Feel a little awkward, a little weird. That gets your body to get a little bit better over time so your body stays back here. If the back hurts, cause leg pain, then get checked out by a doctor. Where it can't get better on its own. If the spine's locked up too much forward like this, then that may cause more symptoms, then get checked out.
The only problem with that sometimes, I mean, the medication, okay,
Yeah.
and if you don't like take pain pills, and if you have a problem, really a big problem with your back, it's either surgery, and you don't want surgery, so, you just stay in pain.
So our job as chiropractors is to see what's going on in the spine,
Yeah.
try to adjust the spine, loosen the spine up, so that you can make the muscles work more, make the muscles stronger. But let's take the pressure off the nerve. No matter what you do, it's going to be sore. You're not going to want to do anything. That's the biggest thing. If you want to do vacation, great. If you want to take drugs, great. If you want to do surgery, great. If you want to fix it so you get better without that, if possible, get checked out by a chiropractor so you can actually see your spine inside to see if it's fixable, and then add more load, add more stretches, add more load, so your body gets back here and stays back here without pain.
Whatever happens if you have, arthritis, bad arthritis, and fibromyalgia, and
Exactly.
lupus, and all that.
That's all part of your examination to see what you can and can't do.
Yeah.
I have people all the time come in. I had someone come in about 3 weeks ago on pain management since 2002 because she had back surgery. But she had discectomy where it allowed these areas to stay open without all the rods and all the screws.
Oh.
So I treated her for about probably 8 weeks, and she's off medications, and she's back to exercising again too.
Wow, that's fantastic.
But everyone's different though. Some people will not get those results. But can you give people sometimes hope that there's a different way? Because you're tired of my biggest thing people come to my office, they're tired of taking medication every day. Because they're dealing with pain every day. That leads to more weakness. Because it doesn't make you want to do anything. My job is to get out there and start walking if you can, it feels comfortable, get your body moving, where you feel comfortable, go back a little bit more. And do some stretching to your body feel it's going back more. That reinforces the back getting stronger versus weaker coming forward. Any other questions before we get baked in here? It's crazy.
Is if you could do, say you can't do the laying down
Yes.
stretching, is walking good enough if you could just
Yes.
walk?
If you can walk, you progress to where you don't have to lie down and stretch your back. Walking feels comfortable,
Even with my walker?
that's fine. With a walker, what I have people do, my wife's mad out of the way, don't tell her that I use Treament. When she can't stop by the office, I just grabbed hers in the garage. Is instead of using a walker here, use it out here.
Oh, okay.
So it makes
Try-
you lean back
Try
more
to stand up straighter.
to counterbalance.
Don't those handles come up a little bit?
Yeah, it should be
They
taller,
should.
shouldn't it?
I'm not a
Yeah, it looks like they're
not a
adjustable.
walker expert.
Maybe they're adjustable.
If they
Yeah,
are
looks like
adjustable,
they're
and see with the cane too, bring it higher so you can come here. People that have a cane all the time use a cane down here, use a cane up here and in front of you.
Yeah, those should be.
But again, wherever you are now, I would start here and just keep it up here and focus, use even your head down at the same time with walking back here. That feels comfortable, and then bring them up and see how that feels. But over time. Okay, I tell people over a period of probably 3 or 4 weeks, get your body slowly change where you feel confident. Okay, and always walk where there's nothing on the ground, obviously, not trip over something. What people do over time when they feel comfortable too, walk with your head up looking down over your nose versus like this with your eyes. Because then your body adjusted too. Again, you got to figure out what's comfortable for you. And if you have balance issues, really be careful with it. That's my next class, I guess, that I forgot about. All right? Any questions there? But higher, the better, and in front of you. If it's here, you lean forward. If it's in front, you lean back to counterbalance. You trick yourself. All right. Any questions about that?
Those people that, they bend backward, are they really stretching the front all the way?
So you're stretching the muscles in the front, but you have 7 layers of back muscle. They probably have good flexibility, good ligament flexibility. I don't have that. I'm 43. I'm old.
No, because I was watching the acrobatic.
Oh yeah, the oh yeah, come on. They do it every day.
So they're stretching that from childhood?
They've been doing that for so long. Ligaments, if you keep them loose, they'll stay loose. They'll grow that way. But realize that they're doing it every day. Have to maintain it. If I could do the splits, if I learned how to do the splits, and I didn't do them for a month, I wouldn't be able to do them again. Ligaments will tighten up again too. Ligaments, they can move. They have some flexibility like muscle, but over time they can shrink if you don't use them. If I sit a lot here, what ligaments, what muscles are going to get tighter? What do you think?
Your upper body.
Here, exactly, upper thigh. Also, back of the knee.
Yeah.
And also my hamstring get really tight.
Yeah.
So when I get up to pick something up from the ground, what happens is I pull my hamstring.
Yeah.
Okay? Or I catch myself going forward and I pull ligament in my hip.
So
Exactly, that's what I said.
once it's tightened up, you can loosen it up again?
No. As long as you didn't tear it, you can slowly loosen up. That's what yoga's for. And Pilates and maybe Zumba here.
You can still loosen it up.
Exactly. That takes work.
Yeah.
Takes weeks and months. I do yoga once a week and it kicks my tail every week. Because I do a lot of weights too. So I have to make sure I get that balance in there.
Yeah, are you gonna do balance next time?
Yes, I will do balance again.
Okay.
Put on my list. Any questions beyond that? So look at that sheet, look at the neuropathy stuff. I'll give you a card if you want to give me a call or whatever it is too. Any questions about that?
Yeah.
If you have not seen me before, I will leave a list. If you want to leave your name and email, I can email you this talk and also a couple things about neuropathy that I have done videos for.
Oh.
And watch me make a fool of myself in my videos.
So it